Good morning. As I was coming into the office this morning, I was thinking about the fact that we've been doing these briefings for 17 months, which seems like a long time. And by the time the next briefing happens, our regular scheduled briefing, we'll be into our 18th month of briefings. So thank you to our colleagues in the media for your tireless work throughout the pandemic. You have done a tremendous job of relaying pertinent information and keeping Islanders informed over the past 17 months. And thank you to the many Islanders and others for taking time to listen to these regular briefings, including this one. I had a sweet little girl come up to me the other day. Her name was Penelope, and she said, "Thank you for keeping us safe." And my response to her was the same as I've said to other people. Don't thank me, it was all of us who worked together to make us all feel safer in the last year and a half. We've previously mentioned that we will get through this pandemic together, and these are not just words. Our collective actions and genuine caring and concern towards others have taken us all to a good place. These actions will remain important as we continue to manage through this global pandemic. There are no new cases of COVID-19 to report today and no active cases in the province. Our last new case was reported on June the 30th. In Atlantic Canada, there have been 45 new cases in the last week and 70 active cases. Approximately 70% of the active cases in the region are on ships off the coast of Newfoundland and Labrador. In the rest of the country, new cases were down a further 27% in the past week, with an average of 382 new cases reported each day. The number of hospitalizations and ICU admissions have also decreased this week. In Canada, the number of active cases is similar to what we experienced in mid-August of last year. These numbers are reassuring and indicate the vaccines are working. We know from the experience in other jurisdictions in Canada and internationally that outbreaks are occurring in some communities and populations with low rates of vaccine coverage. With the spike of cases in unvaccinated individuals and communities, COVID-19 has been coined by some the pandemic of the unvaccinated. It is becoming clearer each day that being fully vaccinated provides excellent protection, although not 100%, from serious illness and hospitalization related to COVID-19. We continue our slow and steady march towards our goal of having 80% of eligible island residents fully vaccinated against COVID-19. As of Saturday, July 17th, a total of 180,606 doses of vaccine have been administered. That's 86.7% of the eligible population who received at least one dose of COVID-19 vaccine and 41.7% who have received 2 doses. A few months ago, during one of these briefings, I was asked if I thought we would actually achieve the ambitious target of having 80% of eligible Islanders or island residents immunized against COVID-19. Many other provinces had a target of 75%. And given our history of high vaccine coverage in PEI, I said I thought we could achieve that goal. So when I look at that number of 86.7% having one dose, it is very good news. PEI does have one of the highest rates of first doses in Canada, and 84% on average of individuals aged 60 and over are fully immunized here in PEI against COVID-19. It is important that we focus on achieving our 80% target in all age groups, including those in their teens and young adults. Over the coming weeks, we'll be working to reduce barriers to immunization among this population. We remain on track to immunize 50% of island residents over the age of 12 with 2 doses by the end of July, and we do have enough mRNA vaccine to reach that target. In PEI, we continue to recommend an interval of 8 weeks between the first and second doses, and this is to allow for maximum protection and the best possible immune response for longer duration. There are some exceptions, including people who are severely immunocompromised, such as those who may be undergoing active cancer treatment. Others may choose to consent to getting their second dose earlier than 8 weeks. For example, some people who may be required to travel out of the province may wish to get their second dose earlier. Youth over the age of 12 who receive their first dose as part of the school-based program will receive confirmation of their second dose appointments very soon. And actually, I got a call moments ago on my way with an automated appointment time for one of my children. So I know it is very soon, so it is starting to happen. I encourage Island residents and visitors who have confirmed vaccine appointments to please attend at the scheduled time. Missed appointments result in missed opportunity for someone else to get immunized. We've been getting questions about the Delta variant. This variant is out-competing other strains of COVID-19. It spreads up to twice as fast as the original strain and is known to partially escape immunity with only one dose of vaccine. It is predicted that the Delta variant will become the most common strain in Canada over the summer and could lead to a fourth wave of COVID-19. We know 2 doses of vaccine provide the best protection against the Delta variant. National modeling indicates that vaccine uptake will need to be higher than originally thought in order to prevent the spread of the more infectious Delta variant. If you're still undecided about getting vaccinated against COVID-19, please do it for yourself, do it for your family and friends, do it so our children can return to school safely, do it to keep businesses open, and do it to help prevent a fourth wave. Sunday was a special day for many island families as they welcomed family and loved ones from away. For the first time since the pandemic began, some people could travel to PEI from outside Atlantic Canada without having to self-isolate. People from outside Atlantic Canada who are fully vaccinated with a PEI pass do not have to isolate in the province. The Premier and I know Mr. McKay and others had the pleasure of being at the airport on Sunday to meet the noon flight. And it was also a chance to see the screeners and the testers and those running the ID Now machines in the airport and see the good work that they are doing. And also just to see and share in that joy and excitement of travelers and island residents was very obvious. As of this morning, over 191,000 people have applied for a PEI pass and 96% have been processed. 48% are from residents from within Atlantic Canada, 31% are from PEI residents, and over 35,000 or 18% are from outside Atlantic Canada. On June 27th, PEI passes were first accepted at the points of entry, initially for vaccinated travelers from within Atlantic Canada, and of course, as of July 18th, for fully vaccinated travelers from outside Atlantic Canada. Individuals with a PEI pass do not have to self-isolate when they come to PEI. International travelers who are fully vaccinated and permitted to enter Canada, who are exempt at the federal border, do not have to self-isolate in PEI, provided they have a PEI pass. Like other travelers from outside Atlantic Canada, they will be tested upon entry to PEI. International travelers who are not eligible for a PEI pass will be required to self-isolate in PEI and will also be tested at the point of entry. Since June 27th, we've welcomed over 95,000 travelers to PEI and tested over 28,400 people at the points of entry with a molecular point of care test. Even with this large volume of testing, there have been no confirmed positive cases of COVID-19 at our borders. In addition to the rapid tests at the points of entry, we continue to have excellent capacity and turnaround times for our lab-based COVID-19 testing. We've completed over 173,700 lab-based tests, and I'm sure many of you remember a year and a half ago when we were unable to do some of that testing here in our own province for many weeks, and we had to rely on the National Microbiology Lab in Winnipeg. Our testing data continues to suggest the risk of importation of COVID-19 is low, and the risk will continue to decrease as more and more travelers and island residents receive their second doses and become more fully protected against COVID-19. Everyone who enters the province will continue to be screened at the point of entry as they have throughout the pandemic. PEI residents should not travel outside Atlantic Canada unless they have their 2 doses of COVID-19 vaccine. As of July 18th, individuals who are fully vaccinated and have a PEI pass can travel outside Atlantic Canada without having to self-isolate when they come home. And this is to clarify because we've had some questions. Many PEI residents applied for a PEI pass after having one dose of vaccine to allow them to travel perhaps to Moncton or Halifax, for instance. However, if they have received their second dose and decide that next month they want to travel to Ottawa, for example, they should carry a copy of their vaccine record with them to confirm they have received their 2 doses of vaccine. And these individuals will not be required to self-isolate when they return to PEI. And I think Marion will be speaking also about how to reinforce how you can get your copy of your vaccine record. As we move into step 4 of the Moving Forward plan, a number of public health measures have changed, and these restrictive measures have had a large impact on our lives throughout the pandemic. And thanks to the support and compliance of island residents, we are in a position to ease more of these measures. And I know we've mentioned them before, but as a reminder, the following measures came into effect on July 18th. Personal gatherings can include up to 50 people. Weddings and funerals can have a maximum of 200 people, and if indoors, cohorts of 100. Activities and events that include close contact, such as sports, theater performances, weddings, funeral receptions, and ceilidhs, can occur in cohorts of 100. Dancing is permitted where appropriate within cohorts. If you do attend a wedding reception or similar event where dancing is permitted, we would recommend dancing with your partner, close friends, and family. Dancing is still a higher risk activity, and it is safer to limit close contact activities with people in your close circle for now. Organized gatherings can include cohorts of 200 outdoors and 100 indoors, and gatherings of multiple cohorts require an operational plan that's approved that addresses, and these operational plans need to address separation of cohorts, washroom and concession stand access, and physical distancing. Although more people are able to gather, and it's wonderful, it's still important where possible physical distancing can be maintained with people outside your household. People should continue to stay home if they are not feeling well, wash their hands often, and be tested if they have any COVID-19 symptoms. Masks continue to be recommended for individuals who are not fully vaccinated when in indoor public places. Our risk of contracting COVID-19 and other viruses is always lower when we are outdoors. If you're fully vaccinated and attending an outdoor event with a small group of close friends and family, masks are not necessary. But if you're immune compromised or not fully vaccinated and are at a large outdoor event or concert where physical distancing cannot be maintained, you may want to consider wearing a mask. We know our risk is higher when interacting with people indoors. If you're immunocompromised or not fully vaccinated and you're at a large indoor event, you should wear a mask and maintain physical distancing. And you should only attend events where the COVID-19 safety protocols are in place and where you feel comfortable. We remain focused on immunizing island residents as quickly as possible. Staff at public clinics and pharmacies across PEI are working hard to achieve our goal of having 80% of eligible residents immunized with 2 doses by the end of summer. When we achieve this goal, we anticipate the remaining public health measures and travel restrictions will be lifted. Testing and screening at the points of entry may continue. The steps we are taking to ease out of the pandemic are positive and giving us lots of hope. Just as we had to adapt individually to the COVID restrictions in the early days of the pandemic, we each have to go at our own pace as we adjust to the easing of measures. I know others have said it before as well. The easing of measures is too fast for some and too slow for others. And I've had people approach us and approach the office saying, we just want the pandemic to be over. And I know I can relate to that. I'm sure Marion can as well. But others have also contacted the office indicating that we've done so well up to this point as a province that we need to go slowly and not take unnecessary risks. Whenever possible, I encourage each island resident and visitor to make decisions based on your own unique situation. If you're more comfortable wearing a mask in indoor spaces, then you should continue to wear a mask as that additional layer of protection. If you're not comfortable to attend an indoor event where you do not know the vaccine status of others, then you may choose not to attend. If you are fully vaccinated and in good health, you may choose not to wear a mask at an indoor gathering where physical distancing is maintained. These are individual decisions. Being respectful, understanding, and non-judgmental towards ourselves and others is our best approach as we transition through this part of COVID-19. And as we say every time, as we continue our journey through COVID-19, and as we get closer to the end, and what we hope is the end, let us continue to be patient and continue to be kind. Thank you. I'll turn it to Marion.
Thank you, Dr. Morrison. Good morning, everyone, and thanks for joining our briefing. I hope everyone is enjoying some of our island summer so far and people are able to rest and recharge where you can. We have been very successful as a province in getting our people vaccinated for COVID-19. Our first dose totals are impressive, and to all islanders who stepped forward and have been vaccinated, thank you. Many people have already received their second dose booking, and I want to let people know that everyone who received their first dose of COVID-19 vaccine at a health PEI clinic on or before June 30th should have already received notification about your second dose appointment. If you have not received notice of your second dose appointment and received your first dose by June 30th, then please call our booking line to make sure you get your scheduled second dose. Many youth who received their first dose as part of our school-based program have also received notice of their second dose appointment, and the remainder of those notifications are happening today. So those should be happening by the end of day today. So if people who have received their first dose in the schools have not received their second dose appointment after today, please also call our booking line. Individuals who received their COVID-19 vaccine at a partner pharmacy will be contacted by that same pharmacy about your second dose appointment. Many people have also already received that second dose of vaccine, and now with increased supply, we're able to change our process for booking vaccine appointments. For our health PEI COVID-19 immunization clinics, we have added additional appointments throughout the summer months as our vaccine supplies increased. These appointments are open and available to individuals who are scheduling their first dose of vaccine or those who may need or choose to get their second dose earlier than the 8-week scheduled appointment, or those who wish to reschedule an already scheduled appointment for personal or health reasons. Please keep in mind the recommendation provided by Dr. Morrison again today that to receive your second dose of COVID-19 vaccine is 8 weeks after your first dose, as this will provide you with increased and longer lasting protection. There must be a minimum of 28 days between your first and second dose of vaccine. We also remind individuals who are making a new appointment at our clinic or in a pharmacy to be sure to cancel any previously scheduled appointment so it can be made available to someone else in our booking systems. In addition to opening our online booking up for both first and second dose appointments, beginning tomorrow, July 21st, individuals will be also able to reschedule or cancel your appointment for your health PEI vaccine clinic through our online booking system with Skip the Waiting Room. Our online booking can be accessed via the website at princeedwardisland.ca/getthevaccine. A reminder of our toll-free booking line number, which you can call if you're not able to book or reschedule online, and that number is 1-844-975-3303. We are continually adding appointments to the vaccine clinics as those appointments get rescheduled or if we have availability of additional vaccine. And so those appointments should now be more readily available on shorter notice. A reminder for everyone of how you can access your vaccine record, and there are 3 ways in which to do this. You can go online by accessing the COVID-19 immunization portal through the government website. You can email VAX record, VAX record@gov.pe.ca, or by calling our toll-free booking line. With the increase in immunization and the vaccine, as we look toward what we do hope is the end of this pandemic, we are also looking at how we can appropriately wind down some of our COVID-19 services that have been longstanding and return to more normal healthcare services. This includes considering how and when to close our cough and fever clinics and eventually move away from some larger scale testing sites. We've already begun just a gradual reduction in testing hours, but there is testing available. But this provides us the ability to allow those staff to gradually be redeployed back to their very important roles they have in delivering health care to Islanders. Updates on this process as we look to make changes, as we roll through this end game of the pandemic, we will provide those updates to those changes. Along with that, though, I want to reassure everyone that if these services are required to surge back and respond to any issues with respect to COVID-19 with an outbreak or something in the community where we have concerns, we can and will quickly return to our full service or surge in those testing or assessment services. I also want to just remind everyone that masks are still required at our hospitals and health clinics and health centers, as well as long-term care homes across the province, until we reach that 80% target of our general population being fully immunized. This is to protect staff, visitors, and our vulnerable patients who are receiving care at these facilities. We know how many people are pleased to no longer have the requirement to mask in most public places, but this still is required in our healthcare settings. Please remember to bring and wear your mask with you when seeking care or visiting a healthcare facility. Thank you to everyone for your continued hard work, cooperation, and adherence to the changing public health guidance as we do navigate this last session of the pandemic. We will keep people updated as things change throughout the pandemic, as we have been all along, and thank you as well to the media who's been communicating our messages. Thank you.
Thank you, Marion, and I will open it up for questions.
Wayne Thibodeau, CBC.
Good afternoon. I guess it's afternoon. Yes, it's afternoon now, Dr. Morrison and Marion. Maybe we can, you hinted, Dr. Morrison, about the fourth wave. I'm wondering, as we watch reports coming in from various parts of the world where we're seeing a spike in cases, how concerned are you about the Delta variant and the potential for a fourth wave here on Prince Edward Island? And what steps do we need to take to prevent that from happening?
Hi, Wayne. So certainly we're also watching some of those increases in cases in Great Britain, Scotland, United States, and elsewhere, mainly linked to that Delta variant. The FAC, or the Public Health Agency of Canada, has come out with their most recent modeling indicating the potential of a fourth wave in the fall and early winter. And so we are wanting to pay attention to that and are concerned of what that could mean. But we also know that making sure we have the highest percentage possible of people who are fully vaccinated is going to be very important for the country and also for this province. So we certainly have a good percentage of people who have first doses. We encourage anyone who's eligible who hasn't had a first dose of vaccine to get a first dose, and how important, especially with this Delta variant, to be fully vaccinated and to get the second dose. So I think in terms of the second part of your question, Wayne, what can we do? We can try to make sure that we continue to vaccinate island residents and make sure that if people are having difficulty accessing from the vaccine, that we'll figure out how we can work with businesses, certain settings to help facilitate that in the weeks and months ahead. And I think the other things that we need to continue to do are making sure people stay home when they're sick, washing our hands. Some of the same basic principles and public health measures that we've been talking about for a year and a half will continue to be important as we go into the fall. So I guess we will continue to monitor and hope that the country and the province can do our best at minimizing any fourth wave or any impact of a fourth wave.
Thank you. I also want to ask a bit about, you talked about, I guess in the briefing, both of you, about the number of appointments being increased, and I know PEI is doing very well in terms of first doses, but when you take a look at the numbers, we're certainly lagging, I think, dead last in terms of the number of people who are getting those second doses. Why are we behind the other provinces, and how do we make up that lost ground?
Well, Wayne, I mean, I think we've answered that question a couple of times in the last couple of weeks. We are at 42% of those eligible with second doses. We know that the number will increase dramatically even in the next week or two as we continue to give second doses. We have kept our recommendation at 8 weeks, and that is the NACI recommendation as well, the National Advisory Committee on Immunization. Wherever possible, to have an interval of 8 weeks between the doses. And that is based on what we know about vaccine immunity, offering longer protection and improved protection if you for most people, can wait 8 weeks. So I think if we reduced that interval, we'd get more people fully vaccinated. But we also want to protect people as we talk about late fall, early winter. We want to make sure they have the best protection possible for the majority of Islanders as we go into the fall. So that is why we've kept that recommendation. Similar to BC, I know, has kept that recommendation, and I know Newfoundland has said very similar. Our recommendation's 8 weeks, but with consent, there are people who may choose to get vaccinated a little bit earlier than that, and there are some particular groups of individuals who do require a shorter interval between vaccine. So we're going to all get to the same place, and I hope that we will have one of the highest fully vaccinated percentages across the country, and that's where we want to get.
Thank you very much for your time.
You're welcome.
Dave Stewart, The Guardian.
Good afternoon to you both. Thanks for taking my questions, as always. I think I'll touch on the mask portion of your briefing. Dr. Morrison, I guess, certainly, as you said, it happened too fast for some and, too slow for others. I think some people were concerned that, I've heard that that the mask mandate was lifted or eased. I know you're encouraging people to wear masks, but that it was eased before everybody had received their second dose. I guess what message is there for Islanders who have that concern that we should have kept masks on until 80% of the eligible population had received their second dose?
Hi, Dave. Well, I guess a couple of points, and I think they're important. One is that really we recommended masks last summer. We didn't have any vaccines at that time, and we had recommended masks until last November. So we were moving back to a place where we were last summer, and we had people being vaccinated on top of that. We have 0 active cases in the province. We have decreasing number of cases across the country and in the region. And we've talked all along about the fact that it's not the first line of protection, it's one of many layers. And as you mentioned, it's recommended. We have BC, Alberta, Saskatchewan, NWT, ourselves who have moved from mandatory to recommended, and I think other provinces won't be too far behind as well. So I think it is something that we did looking at the evidence, looking at where we were previously, and I think it's important that mandatory restrictions are kept for the minimum amount of time that's required, and still trying to keep everyone safe. And I think we've done that for 17, almost 18 months now, and we're going to continue to do that and weighing that, I guess, balancing those restrictions with keeping everyone safe.
Thank you very much for that. Just a follow-up question, I guess, sort of still a mask question. I've noticed, and others have noticed, that some food service workers are still wearing them. I would say the majority that I've seen are still wearing them, and I've seen some in the food service industry that aren't wearing them right now. Is it still a recommendation? Are there any hard and fast rules for people who, whether you work at Sobeys or whether you work in a restaurant, that you should be? Is it recommended? It's not required, recommended? Your thoughts on that?
Yeah, so we have it in our language that it is recommended for those in the food service industry and where they would be within 6 feet of any clients or patrons to wear a mask, and that we have been in communication with the PEI Restaurant Association, our office, and I believe they've also communicated that to their various members. So that is the recommendation at this time.
Terrific. Thanks very much.
You're welcome.
Louise Martin, CBC.
Hi, good afternoon to both of you. Thanks for taking our questions today. Boy, 17 months, eh? So I just wanted to start when you mentioned, Dr. Morrison, looking to that future goal of 80% of fully vaccinated islanders, and that at that point we could see some of the, or maybe all of the public health measures disappear. Would that include allowing unvaccinated visitors to travel to Prince Edward Island and avoid self-isolation?
So, Louise, that is absolutely a good question, and we are looking at that. We know there are some people who are unable to be vaccinated and or may choose not to be vaccinated, and know they are anxious to also travel. And we will be looking at closer to the time at what the situation is in the province, the region, in the country, and but that's why there's also some indication there may be a testing and screening component for those who are unvaccinated, knowing that they have a higher risk of getting COVID-19 and being sick as well with it. So we know that if we look too far ahead, every time we look too far ahead, things change. But at this point in time, that would certainly be certainly part of the plan that we would be looking at easing some of the travel restrictions as well as the other general public health measures when we achieve that 80%. But it will be based on the epidemiology, the evidence closer to that time.
Thank you so much.
You're welcome.
And then as we look to August and our American family and friends that will be able to travel to Canada, can you just go over, is it the similar rules for those outside of Atlantic Canada right now? They have to have a PEI pass and come here. How are you feeling about that Canadian border open to the United States?
Well, Louise, I think you summarized it well. I mean, when the visitors from the U.S. are exempted at the border to come into the country, they will be fully vaccinated, and to have a PEI to get to Prince Edward Island, they will be treated very much like other visitors from outside Atlantic Canada requiring a PEI pass, meaning they're fully vaccinated, and they will be screened and tested upon entry. And really, whether you live in Maine or in Ontario, those same rules will apply. And except that some of the U.S., if you're traveling through the federal border, they may also be tested at that point as well as here in PEI.
Okay, thank you very much.
You're welcome.
Gabrielle Drummond, Radio-Canada.
Good afternoon to you both. Ma question, c'est en français pour la Dr. Edda Morrison. Je sais que vous avez déjà répondu ça en anglais, mais j'aimerais l'entendre en français. À partir du 9 août, les touristes américains entièrement vaccinés vont pouvoir entrer au Canada et ici, à l'île du Prince-Édouard. Et on sait que certains insulaires sont très préoccupés par rapport à l'arrivée de ces touristes ici à l'île. Alors, que dites-vous à ces personnes qui ont de craintes, surtout parce que la grande majorité des insulaires n'ont pas encore reçu les 2 doses du vaccin et le variant Delta fait quand même de ravages partout dans le monde. Alors, que dites-vous à ces personnes qui sont préoccupées?
Bonjour Gabrielle. Alors, en premier, ces visiteurs des États-Unis sont double vaccinés. Et ce que je comprends, ils vont avoir un test aux frontières fédérales. Et puis, quand ils arrivent à l'île du Prince-Édouard, ils doivent aussi avoir le PEI Pass qui montre qu'ils ont les 2 doses de vaccin. Ils vont être testés quand ils arrivent. Et alors, ils sont traités vraiment même que quelqu'un qui arrive, famille d'Ontario. Alors, je sais que si on a plus de personnes, on a un peu plus de risques, mais on voit que le nombre de cas dans la région et au pays, ça diminue. Et on sait que la majorité des personnes qui sont double vaccinées n'ont pas le même risque d'avoir COVID-19 ou de transmettre COVID-19. Alors, et c'est n'importe où vraiment qu'il vient. Alors, je sais que c'est un changement, mais c'est vraiment, on fait des pas vraiment avec les visiteurs de la région atlantique, hors de la région atlantique et du Canada. Et maintenant, c'est un autre pas. Et à ce moment, on va avoir bien plus que 50% des insulaires qui vont être double vaccinés. Et j'espère bien plus que ça pour le 9 août.
C'est ma prochaine question. Vous l'avez aussi mentionné en anglais. Mais bon, l'administration de cette 10e dose, elle semble aller beaucoup plus lentement ici à l'île que dans les autres provinces. Alors, j'aimerais que vous nous expliquiez pourquoi ça arrive présentement. Est-ce que la stratégie que vous avez adoptée pour la prise de rendez-vous de la 2e dose a moins bien fonctionné à votre avis? Comment vous allez faire pour accélérer la vaccination de la 2e dose?
Je pense que notre programme de vaccination, ça va très bien. Et puis, on a une des pourcentages de personnes à avoir la première dose, c'est une des plus grands au pays. Et puis, je pense que l'importance de garder 8 semaines entre les 2 doses, si c'est possible, sauf que pour certaines personnes qui ont le cancer, comme exemple, est important pour que on soit protégé pour le meilleur possible, pour le plus longtemps que possible. Je veux pas on n'est pas protégé en décembre. Comme exemple, on veut qu'on garde cette recommandation, qui est vraiment une recommandation nationale. Et puis, alors, mais on sait que si quelqu'un choisit d'être un peu plus, moins de semaines entre les deux doses, peut-être parce qu'il doit voyager, il peut en faire, mais il faut qu'il comprenne que c'est une recommandation d'être aussi près que 8 semaines que possible. Et puis, c'est pas une course à ce moment. On a moins de cas au pays. On a 0 cas ici actifs. Et on veut que tout le monde arrive à être double vacciné. Ici à l'île du Prince-Édouard, mais aussi ailleurs. Et on va voir, mais j'espère que peut-être l'île du Prince-Édouard va avoir une des plus grands nombres, pourcentage d'être double vacciné à un moment donné. Et puis, si quelque chose change, on peut ajuster, mais on a assez de vaccination pour donner à tout le monde. Et puis, on sait que le nombre va continuer d'augmenter chaque jour.
Parfait. Merci beaucoup. Bonne journée.
Bonne journée. I think that's it. So thank you very much and have a good afternoon.